Everyone has normal mast cells. Some people have normal mast cells and dysfunctional mast cells. And so in this case, they looked at if you had at baseline a healthy patient, a patient who did not know they had MCAS, and a patient who was treated already, knew they had MCAS and treated, what would happen, what they were seeing with COVID patients. And so what they found was that at baseline, the people who were untreated MCAS, they didn't know they had it, they had at baseline inappropriately activated mast cells, even at baseline. They didn't know it, and they were the same as the diagnosed patients, except the diagnosed patients, because they were on treatment, had better control of their abnormal mast cells. And then they got COVID, and what they found was that the healthy people, because they didn't have abnormal mast cells, had a normal response to COVID and then recovered. The patients who did not know they had MCAS had appropriate mast cells if they were normal, but the dysfunctional mast cells were inappropriately activated, overactivated, releasing cytokines, right? This is the cytokine storm that everyone talks about. And then after recovery, their mast cells do not return to normal as they would in a normal person. They continue to be activated. And the patients who are controlled with MCAS, they found that at the end, they were more controlled through the illness. And this is what we're seeing in our patient population. We don't see a lot of our patients getting long-haul COVID because they've been in my practice, they've been pretty well controlled. Whereas the patients that I'm seeing who I haven't been treating, who have post-COVID syndrome and are coming to see us because they're suspicious that there's something going on with their immune system, we're finding that they probably had MCAS before, they didn't know it, and now they're still sick. So this is a big piece of the puzzle.